The pregnancy journey for new moms is usually a happy time, but it is also a time when questions and concerns come up about the unknown and what to expect. Hi everyone, I'm Neki Mohan, your host for today's discussion, coming to you from the Baptist Health Newsroom. When it comes to a mother's health, it is important for pregnant women to listen to their bodies and maintain a healthy lifestyle, not just for themselves, but for that baby growing inside. Today we'll talk about strategies for maintaining the health of both mom and baby, debunk common pregnancy myths, and explore potential pregnancy-related conditions. Today we're joined by nurse educator for labor and delivery at Baptist Health South Miami Hospital, Lisa Acosta. Great to have you with us. And we're also joined by Dr. Larry Spiegelman, Chief of Obstetrics and Gynecology at Baptist Health Baptist Hospital. Happy to have you both. Dr. Spiegelman, thank you both for being here.
Thank you. Happy to be here.
Good. This is going to be a great discussion. And of course, before we dive into today's subjects, I want to remind all our viewers that this is your discussion. Send in your questions, send in your comments. Let us know what you like, what you didn't like. It's all in the comment section throughout the discussion. We are here and we're happy to answer the questions you may have. Actually, they're going to answer all the questions that you have. We're going to start with Lisa. For pregnant moms, maintaining good health for them and their newborn is so important. What do you recommend? What are the measures you recommend for the new mom?
Okay, so I think one of the most important things is that you find a healthcare provider that you trust, somebody who listens to you. I think this is an important relationship that you're going to have throughout your pregnancy, and they're going to guide you all the way through to the finish line. The second thing I believe in is to take care of yourself. Eat right, sleep right, exercise every single day. You owe it to yourself, and it's a great way to protect your body, to protect your baby, and to protect your birth. And then lastly, probably because I'm a childbirth educator, I believe strongly in taking classes and getting your head in the right space, understanding a little bit about the physiology of birth, knowing about the resources that you're going to have to use at the hospital or wherever you plan to deliver, and just knowing ways to move your body during your labor and during pregnancy as well.
Yeah, I mean, and there's a lot going on. It always seems like, it should be natural. You just have the baby, it comes out, it's great. It's like,
right.
But as you know, it's far from that.
Right.
It's a lot.
Yeah, it's a process.
It is a process. And that's where Dr. Spiegelman comes in. During pregnancy, women are told we got to refrain from certain things. We got to refrain from certain activities, substances, including over-the-counter medications. What are the things that expectant mothers should immediately know when they are pregnant or they're about to be pregnant?
Well, so one of the first things that we always talk about is before you get pregnant, right? Because there's a lot of medications that are over the counter and that are prescribed that may be either helpful or detrimental to a pregnancy. So one, it's important to consult your physician before you get pregnant so you can work through those medications. Once you're planning to get pregnant, taking folic acid is extremely important. Folic acid has been shown to significantly decrease the risk of spinal defects and skull malformations, and taking the appropriate amount of folic acid before you get pregnant is important because all of that stuff forms before you hardly even know you're pregnant. In addition, you got to be careful of the amount of certain over-the-counter supplements you're taking. Vitamin A, for example, has been shown to be toxic in certain high levels. So you have to be careful about some of the supplements you're taking so that you're not taking excessive amounts of supplements, because we always think supplements are good for you, but not necessarily all of them. And then once you're getting pregnant, there's a few other things you need to think about. One would be obviously to debunk the myth of I can have a glass of wine here and there. The truth is, no one has ever done a study on what's a safe amount of alcohol in pregnancy. Think about it. If you were going to do a study, how do you say you drink 1 a day, you drink 2 a day? Oh, 2 was too much. So you have to really be careful.
Who's going to volunteer for the research?
I wouldn't, or I certainly wouldn't have my wife do it. So I think that the answer is we know no safe level of drinking or smoking or drugs and alcohol because there is no way to actually know the right answer to that. And the last thing that I'll touch on is a lot of people have been reading a lot about Tylenol or acetaminophen. And acetaminophen has been a staple for what we use for pain, for headaches. And there are some potential side effects of acetaminophen. So we're really encouraging people to take it as minimally as possible during the pregnancy as one of those newer things that are coming out in the literature now.
Yeah. mean, also important. Lisa, there are several myths about what a woman can and cannot do during pregnancy. One example of misconception is exercising is detrimental to the baby. This is a common pregnancy myth. What are some other myths that are common? Because I know I exercised up until the day before I delivered my almost 10-pounder.
Yeah, so lots of myths out there. Anything from having heartburn, depending on how hairy the baby is.
That's not true?
No, not true.
Because I had heartburn and the baby was here.
How you carry the baby, determining the sex of the baby. Not true. And then like you said, not being able to exercise, to not coloring your hair, not having sex. There's a lot of those type of myths out there. But I think one of the good bits of advice that you might have heard or read is to actually rest and sleep on your left side. So that helps with placental blood flow. It helps to keep your heartburn down, but it also, towards the end of your pregnancy, helps to get your baby into position, right? So babies that come in, when you go into labor and your baby's on the left side, they have a better chance of tucking their chin and of entering the pelvis in a more efficient manner. So that is part of my Spinning Babies training coming out. It's one of the classes that I teach.
Oh, wow. I wish I took that class. Yeah. So Dr. Spiegel, maternal mortality is a big issue and a conversation here in America. Why and what can we do to help that?
So that is a huge conversation because you'd think as one of the top countries in the world in healthcare dollars spent, we would have the lowest mortality rates, and that's actually not true. And a lot of it has to do with what we call social determinants of health. It's a really, really hot topic right now, and the things about social determinants of health include age of the mother, and we're seeing mothers older and older as they're having careers and putting their childbearing years off. Race has a huge role in outcomes that are related to pregnancy, whether you have insurance or whether you don't have insurance, and really kind of where you live has a huge role in your access to healthcare and how you'll end up. And it's not just during the pregnancy alone. And this is something that we're really pushing, and the state of Florida is pushing, that it's the after delivery for up to 6 weeks. Actually, we see that significant increased risk in things like stroke, heart attack, and death that are happening in the first 6 weeks after delivery. So it's an area of really concern where you need to be able to still communicate with your physician after you deliver or your healthcare provider, and that you still follow up and make sure you get that care, because that actually is as much of a critical time as it is during your pregnancy itself.
Yeah, full disclosure, I was one of those, and thankfully I had a good open conversation with my doctor, but I remember people telling me, you're supposed to feel bad when you have a baby. Mm-hmm. And as you both know, there's no two pregnancies are the same. Wouldn't you agree, Lisa?
Yes, for sure. And I know now we're suggesting that patients follow up with their doctor not just at the 6 weeks, but actually at the 2-week mark. So that way we can catch if the blood pressure's on the rise, if there's any issues going on, even mental health issues, that we're catching that early.
I will tell you, it was my nurse that told me, I need you to check in every day. Because your white blood cell count is climbing really fast.
That's great.
You know, so having that healthcare and having those conversations as soon as possible. And I was 36, which was considered old then, but you know, it's like almost median now.
Yeah.
Certainly in our community, for sure.
You know, these soon-to-be parents, individuals often wonder what is the optimal approach to ensure the well-being of their child. Is it advisable to consume those prenatal vitamins that Dr. Spiegelman talked about? And what's the recommended frequency, like we were just talking about, for those medical checkups? You say in some cases you recommend 2 weeks after, or...
Well, yeah, that would be after you deliver, but during your pregnancy, and even before you get pregnant, like doctor said, we want to be taking our prenatal vitamins actually several months prior to even becoming pregnant, so that we have all of those good building blocks in our system when the embryo is forming. During the course of pregnancy, most healthy low-risk moms are going to be on a schedule where they see their physician or their provider about every 4 weeks. So every 4 weeks for the first and second trimester, and then you'll start going every 2 weeks for a little bit, and then towards the end in your last month you'll be going weekly, and you are being screened for many things. There's lab work, there's ultrasounds, there are screenings, there's vital signs that are being taken, the baby's heartbeat, the fundal height, how your belly is growing, urine dipsticks, and all of these things are done pretty quickly and pretty routinely, especially when you're having a healthy pregnancy. If you become high risk for any reason, and there are many reasons, you'll actually see another doctor. You'll see an MFM, which is a maternal fetal medicine specialist, and they'll be watching you even more closely. So yeah, it's important. We have to take care of ourselves when we're pregnant. It's not just about us, it's about the baby.
Yeah, and some of those conditions that are common are gestational diabetes, preeclampsia. Dr. Spiegelman, talk about these conditions and the impact it could have on the pregnancy and how important care is, especially if you're diagnosed with any of them.
Sure. So gestational diabetes is diabetes that you get just related to pregnancy and really has it's not necessarily related to having diabetes beforehand. And what's interesting about it is that if you are diabetic during pregnancy and require insulin, about a third of those patients will become diabetic later in life.
Wow.
So it's really important that you get screened for diabetes during the pregnancy, not only for the risk of growth and other issues that can be associated with diabetes, and then problems with the baby when the baby's born, but more importantly, for your general health. And the one way you can actually work on that is trying to maintain your weight during pregnancy, where we know obesity is associated with a lot of these problems, and trying to maintain your weight in a normal healthy patient would be somewhere between 25 and 30 pounds during the pregnancy will help keep you from having some of these problems. The other is preeclampsia that you mentioned. Preeclampsia is a combination of having high blood pressure and as well as some kidney issues where you're spilling protein in your urine. And those two things can then lead to other problems, including and up to seizures. So it's one of those conditions that you really need to follow your physician every week in that last month when it's most likely to happen. And those are the things that we're screening for to make sure that you end up with a healthy ending of the pregnancy, even though everything's been going beautifully beforehand.
This is so important to talk about because so many people feel like it's natural to have a baby. It's natural for a lot of things, but it's really a big, complicated process. There's a lot of stuff going on at the same time.
It is, but we want to emphasize most pregnancies are normal and straightforward, and that's the good news. But seeing your healthcare provider is extremely important in making sure that these other problems are detected so that you can end up with a healthy pregnancy.
Yeah, and then, okay, so now rapid fire round with questions from the viewers. Is it normal to have morning sickness all day?
It can be for some folks. Usually it's in the first trimester. Kind of peaking around the 10th or 12th week. Most folks will start to feel better by 16 weeks, but it's all day.
Yeah. But there are some good medications that are also available, and they're actually natural, and especially vitamin B6 has been shown to be extremely helpful in helping nausea. And so there's a lot of medications that are out there that actually can help somewhat with that nausea.
Yeah. How much weight, let's talk about weight. How much weight is it normal to gain during pregnancy? I did very badly. I just ate everything in sight. There wasn't a drive-thru or a buffet. I was like, wow, I can finally gain some weight. Right. But it really is not healthy on your body.
So we talked about 25 to 30 pounds as a normal. But once again, if you're going into the pregnancy with the risk of obesity, then we recommend significantly less weight, and that's going to be more like in the 10 to 15 pound range. Yeah. So, I mean, it really depends on how you start the pregnancy in terms of our recommendations for weight gain.
What about the people that are scared to gain weight? Because we have those as well. Mm-hmm. Can we talk about the conversations that you have with someone who's trying to get pregnant, but is concerned, oh my goodness, am I going to look the same after I have this baby? Or may have an eating disorder.
Right. I think you have to strike a balance. If you are starting off with a healthy BMI, you're actually really not eating for two, kind of until you're at least halfway there. And even then, you're only eating for maybe 1.2. So really, you're eating maybe an extra 500 or 600 calories a day. But it is normal. I think we do have to normalize gaining a certain amount of weight. Babies do put on a lot of weight towards the end of pregnancy as well. But and it depends on where you're starting from. If you're underweight, if you're normal weight or overweight, it's going to impact how much you should gain. But we should gain some weight. It is important to give the baby the building blocks they need.
I'm just going to add one thing that I think if you add up all the pregnancy weight that's normal and physiologic, that's about 30 pounds of weight gain between placenta, uterus, amniotic fluid, baby, extra blood volume, all of these things that happen to your body. So if you're overweight, that's why we encourage you to gain a little bit less so you can actually be easily back and under your pre-pregnancy weight. Where if you're a normal weight, 25 to 30 pounds puts you right back at your pre-pregnancy weight beforehand.
Yeah, and you need to stay healthy when that new baby comes, because it's going to be a lot of work. A lot of work to be done. What about travel, Dr. Spiegelman? Can I travel when I'm pregnant?
Absolutely, unless you, of course, have a medical problem, at which point your doctor or physician would tell you what you can and can't do. Most of us recommend traveling is okay up to 32, 34 weeks. The only issue with travel is a lot of people are sedentary for long periods of time, whether it's on an airplane or in a car. You want to make sure that you get up and move around a lot, because when you're pregnant, your risk of getting a blood clot in your leg is a little bit higher. So you need to get up and stretch. Fortunately, most pregnant women have to go to the bathroom a little bit more. So it makes you stop and get up and move around, but it is an important issue.
And there's stylish compression socks.
Yeah, there are.
You know, when should a pregnant woman start taking prenatal vitamins? Especially if you're planning your family. You have the luxury of planning it.
Well, several months before you even do get pregnant. I would say at least 3 or 4 months prior. Mm-hmm.
Yeah. And what about, you talked about it, dyeing your hair.
Yeah. It's not something I do anymore.
Is that a myth?
There's not a lot of hard evidence about the risk of doing so. I do think, though, that especially in the early stages of your pregnancy, I think the less chemicals you can expose yourself to, the better. But then I think once you're in that second trimester,
because is it like the wine where they haven't done research on people, people doing their hair?
There's not a lot of stuff, but I agree. I think the least things you can expose yourself to in the first trimester while the baby's forming itself, I think that it's probably best to avoid. But I always start with a little joke: what color are you going to make your hair? Like it makes a difference. Yes. It really doesn't make a difference, and I think probably it doesn't, but we just don't have the data to support that.
Yeah. I want to get back to the whole maternal problem, the death rate problem in this country. If someone's watching this and they're pregnant now, what should they know to communicate, or what should they know about how they're supposed to feel after they have their baby? Because a lot of these complications happen post-delivery. Mm-hmm. What recommendations do you give that new mom? So we talk about postpartum depression.
Right. I think if you are at risk, if you do have preeclampsia, if you did have gestational hypertension, it's important to have a blood pressure machine at home and keep a log. I would definitely look for that. I think it's important in pregnancy to build a support system around you. You want your partner to feel involved and to know how to help. Okay, another great reason to take childbirth classes together with your partner. And then also to kind of reach out to friends and professionals and maybe kind of build up a support system around you. If you're planning to exclusively breastfeed, finding a good lactation consultant that can help. Afterwards, pelvic floor therapy. There's a lot of help for moms out there, but you kind of don't know what you don't know. So there's a lot of help out there.
Yeah, no, absolutely. Mm-hmm. Dr. Spiegelman, any closing thoughts with
this conversation? I think that the social determinants of health are really very important, and that really depends on your risk factors. But I think that if you do have risk factors, and even if you don't, it certainly makes sense that if you have symptoms that are unusual, like severe headache that's not relenting, blood clot in your legs, meaning pain, chest pain, which you should never have postpartum, you should contact your healthcare provider right away.
Yeah. Well, thank you so much. Thank you. It's been a great conversation. I know our viewers have enjoyed it. Remember, viewers, be sure to hit that subscribe button on our channel right here to keep up with all the latest health and wellness information and tips from our experts. And you can also connect with us on our social media channels: Facebook, Instagram, Twitter, TikTok, even LinkedIn. And of course, always check out the resource blog for the latest news at baptisthealth.net/news. You can find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy, and thanks for watching.